So today I'm going to talk about a topic that's actually a question. If you've had COVID-19 infection yourself, is the vaccine that's now available, any of them, is it safe for you? I'm Dr. Chip Whitney, and the actual answer to the question is we just don't know. Unfortunately, and no fault of the researchers, that none of the research done on the vaccine leading to the release of each one of them was done on people who had the disease. And there is reason to believe that it may not be safe in people who have actually had the disease. So first off, I want to discuss that I am not an anti-vax physician. I'm a family physician, and I recommend every day, almost all of my patients who are in any realm vulnerable or intermediate vulnerability to getting a bad outcome from the COVID-19 disease, which can be devastating, I'm recommending to get the vaccine all the time. But I had COVID-19 myself. It's been a year now. I had the disease itself. I fortunately did well through it, but it makes me think a lot. And unfortunately, I don't hear many doctors talking about the safety of the vaccine in someone who's had the disease. And especially now that they're talking about creating vaccine passports for people, in which way I'm not exactly sure how it's going to be used. But these passports are going to be to document that you've actually had the vaccine if you want to do this or that. If businesses so choose, they want to keep people at less risk. So it worries me because I actually tested my antibodies just recently when I hit my year anniversary of having the disease, and I actually had antibodies to COVID-19 still. That's probably the exception of the rule, but it definitely suggests that there is some long-term immunity that occurs when you've had the disease. There's studies ongoing that are looking at people who back in the spring of 2020 had the disease, that they're watching them and they're finding out on all levels of immunity how many people are protected. And now they're looking at 6 to 9 months. It looks like a large percentage of the people who had the disease back then were still protected. So if you've got antibodies and your immune system is protecting you against the disease, that you should not be at risk to yourself or others if you get it. So that's just basic immunology, how these things work. So eventually we're going to lose our immunity to it most likely, but there are some infections like tetanus and measles and hepatitis where the immunity from a vaccine can last, and from the disease itself can last a long time. I mean, you get chickenpox when you're a kid, and you may not have any issues till a lot later in life when you get shingles. Other things like the flu shot, the flu infection, it needs to be a vaccine every year. So we just don't know about COVID-19, how long the immunity lasts. So in making the decision, and it's a personal decision, is that you have to look at risks and benefits. So we are seeing, so the benefit is minimal in getting the vaccine if you've got immunity already, like I do, and the benefits are great if you've never had the disease, because it is such a devastating disease in some people. So, but if you had the disease, it's questionable. What's the risk of the vaccine? So number one, studies, there are no studies, and no doctor can tell you that it's a safe vaccine for people. We don't know if it's a safe vaccine for kids too. And now I'm hearing that there's some discussion on having the vaccine given in kids. And I am slow to jump on new things when they occur. This one I am, for obvious reasons, for people at risk. But in low risk people under 40, I've watched over the years drugs and vaccines taken off the market because nothing was found to have problems when they was being developed. But once it was released and millions of people were getting the intervention, we found problems and the FDA pulled it off the market. Perfect example is the Lyme vaccine back in the 1990s. It was on the market for 2 years. It looked like it was going to be good, no problems in pre-release science behind it. And then it ended up getting pulled from the market because they started to see autoimmune problems develop when people who got the Lyme disease. So, I mean, if in this case, it could happen, I'd probably not. I mean, it looks like it's to be a really safe vaccine and probably will be, but we just don't know. And if you're 60, 70, 80 and develop a complication of it, well, that's one thing. But in kids and young people where the likelihood of them having a bad outcome, even hospitalization or much less death, I mean, the death rate in people under 40 who don't have other risks is really, really low. we got to ask the question, how is the benefit of the vaccine worth its potential risk? But more importantly, I recommend the vaccine in the majority of my patients because of the experience I know with the flu vaccine. The reason for the flu vaccine is not to prevent yourself from getting the flu. I mean, yeah, it's nice not to get sick, but people get heart attacks from the flu. Why is that? Well, the heart attack occurs when inflammation, any type of inflammation, where it's bacteria from your mouth hitting a vulnerable plaque in an artery, or influenza driven inflammation. Influenza causes a big inflammation that if people have a vulnerable plaque, some people get heart attacks. So the risk of heart attack and stroke goes down significantly if you had a flu shot. And that's the major reason I recommend the flu shot every year in people. So what about COVID-19 vaccine? Well, number one, we know that COVID-19 elicits a major inflammation, and that's the problem that occurs with all the complications in people. And I am seeing, and the reason I decided to do this is that it seems that almost everybody I know who got the vaccine, who had the disease, got really bad side effects. I mean, you expect side effects, and more so with this vaccine than others because it does work so well. It's doing a good job of stimulating your immune system to protect yourself. But if somebody's already got an active immune system against the disease, it makes sense that they're going to get bad side effects because it's taking an already heightened immune system to fight off the vaccine and eliciting even more inflammation. So the problem with that is that in terms of the safety of the vaccine in somebody who's had the disease, again, that what if a person has a vulnerable plaque, that if the plaque ruptures, it can cause a heart attack, or if it happens in the neck, it can cause a stroke. I'm 57. I feel like I'm healthy. I do good, healthy things, but I'm not going to be naive in saying that I might not have a vulnerable plaque out there. A lot of people in their 50s have heart attacks. So my question in my own personal health is that, and the question is not answered yet, is the vaccine safe in me? Well, I don't know. I mean, it could be, but we just don't know. And I know that I've got some immune protection, even though I'm a year out. We don't know for me, unfortunately, but anybody who's had the vaccine within 6 months, even 9 months, who's had the disease within 6 months, even 9 months, they're likely protected because that's what the studies are showing. The science is showing that most people have good immunity at 6 to 9 months after they've had the disease. So again, it's a personal decision. I encourage most people who have not had COVID-19 themselves to get the vaccine, but I do encourage those of you who have had the disease to think about it. Think about your situation. How at risk are you? And talk to your doctor about it, because it really is an important decision about whether or not you decide to get the COVID-19 vaccine. And I hope that as these vaccine passports or whatever documentations of people who've had the vaccine are done, I hope they take into account the people who've had the disease as protected and safe to other people as well. Again, I'm Dr. Chip Whitney.